we'll talk about the joints or articulations. First, we'll see the classification of joints. Then we'll talk about the most common type joint of our body, which is the synovial joint. So synovial joints are the most common type joints in our body. We'll see the properties of a synovial joint. Then we'll talk about the movement. We know that movement of the body parts occur at the joints. So joints are the locations where we move our body parts, right? What are the different types of movements occur in the body parts at the joints? So we'll see that. Then we'll see the structure of two large synovial joints of our body. One is the knee joint and another is the shoulder joint. Just to get an idea about the structure of a synovial joint. So first, what is a joint or articulation? A joint is the structure where two or more bones unite or meet. So joints are the structures where two or more bones unite or meet. Now we classify the joints based on two things. First, we classify the joints of our body in two ways. One is structural and another is functional classification. Okay, so structural and functional. Functional classification is based on the amount of movement occurs in the joint. We divide the joints into three types based on the amount of movement. Symphysis, where no movement. Symphysis, where you have a small amount of movement, and diaphysis, plenty of movement. Okay, so SAD, SAD, remember SAD, symphysis, immovable, no movement. Symphysis are the joints where you have a small amount of movement, and diaphysis are the joints where you have plenty of movement. Okay, example of no movement. You know, the sutures are the joints where the cranial bones and facial bones unite. So these are the sutures, and these are immovable joints. You cannot move the bones at these joints. So symphysis. Symphysis, good example is, you know, when you breathe, the ribs move slightly, right? Little bit movement occurs. So the sternocostal joints, small amount of movement occurs. Diarthrosis, plenty of movement. Shoulder joint, elbow joint, lot of movement, right? So those are functional classification or types. Then structural classification, based on the structures hold the bones together. For example, here you see which structure is holding the bones? Cartilage, right? So based on the structure holding the bones together is structural classification. First, we divide into two types: fibrous, that means fibrous connective tissue holds the bones together. Cartilaginous, that means cartilage holds the bones together. So in cartilaginous joints, cartilages hold the bones together. In fibrous type joints, fibrous connective tissue holds the bones together. Now fibrous could be three types. This side. Sutures, syndesmosis, and symphysis. So these are three types of fibers: sutures, syndesmosis, and symphysis. Cartilaginous, there are two types: synchondrosis and symphysis. Remember the word we use here is SES. SES means more than one. SIS, if I say symphysis, I indicate only one. Or synchondrosis, I indicate only one joint. But if I want to indicate more than one, we use the term SES. Okay, plural. Okay, so this is the way how we classify the joints. Yes, so here you can add another one, structural classification. Just add one more type, that is synovial. Okay, synovial. This is the most common type. Okay. So structural could be fibrous, cartilaginous, or synovial. Functional, symphysis, amphlectosis, diarthrosis. Okay. Now, if you just keep this classification in your head, it will be easy for you to follow. So here you see structural classification: fibrous, cartilaginous, synovial. Okay. Now fibers could be sutures, syndesmosis, symphysis. We'll see that three types of fibers. Okay. Here you see sutures, syndesmosis, and symphysis. Sutures, I have already shown you. The cranial and many facial bones are attached by the sutures. Very short connective tissue fibers connect the bones together. Here, if you see under the microscope, you will see very short connective tissue fibers, and the border of the bones, if you see, for example, this is one cranial bone. You know that cranial bones, parietal or occipital bone. This is another cranial bone. How they fit to each other like this, forming interlocking. like this. Okay, interlock each other. So will fit like this. Okay, and the bones are connected by short fibers. Syndesmosis. The bones are attached by ligament. You know that ligament is formed by fibrous tissue. That's why it belongs to fibrous type of connective joint. So fibrous tissue structure ligament holds the bones together. And example here they have shown the distal tibiofibular joint. This one, you know, tibia and fibula, they have two joints, proximal tibiofibular here and distal tibiofibular here. There is a ligament here that holds the bones together. Gymphosis. Gymphosis is the joint formed by the tooth and the jaw bone. So the gymphosis type joint is only found in the mandible and maxilla, where the teeth articulate with the bony sockets in the jaw bones, okay, by a ligament that is called periodontal ligament. So periodontal ligament is the ligament that attaches the tooth to the bony socket. You see here in the picture periodontal ligament. So that is the gymphosis type fibrous joint. Okay, so those are three types of fibrous joint: sutures, syndesmosis, and gymphosis. Right? Now we'll see the cartilaginous joints. Cartilaginous could be synchondrosis and symphysis. Very simple. In synchondrosis, what type of cartilage articulates the bones? Hyaline cartilage. So if you see that bones are attached by hyaline type cartilage, that is synchondrosis. Example, you see here, this is the first rib and this is the sternum, manubrium of the sternum. So this is a hyaline cartilage. So this is a synchondrosis type joint. Okay. Remember one thing, we don't include these in synchondrosis, although these are hyaline cartilage too. The reason is these joints have some properties of synovial joint. They have cavities inside. That's why these belong to synovial. Only the first rib with the sternum, manubrium of the sternum, that is the synchondrosis. Symphysis. The bones are attached by fibrocartilage. So if you see, the bones are attached by fibrocartilage, that is a symphysis joint. For example, here, these are intervertebral discs are fibrocartilage. So these are symphysis type joints. This one, pubic symphysis, you already know. This is a fibrocartilage. So this is another example of symphysis type of joint. Okay. So synchondrosis, hyaline cartilage, and symphysis, fibrocartilage. Okay. So very simple. Okay. Here you see synchondrosis, hyaline cartilage. I have already shown you the first rib with the sternum. Another example is the head of long bones articulate with the shaft, although you don't see from outside. If you see inside the bone, you'll see thin plate of hyaline cartilage. That is called the epiphyseal plate inside, and that is another joint where the hyaline cartilage, thin plate of hyaline cartilage connects the head and the shaft. Intervertebral discs, pubic symphysis, those are symphysis type because those are fibrocartilage. Okay, now we'll talk about the most common type joint, that's the synovial joint, right? So synovial is the most common type, and most of the synovial joints have plenty of movement. Most of the synovial joints have plenty of movement. The reason is synovial joints have cavity inside. That means there is a space between the bones, cavity or space between the bones. Now I will show you the properties of a synovial joint. What are the things you should be able to find in a synovial joint? So these are the ends of the bones joining together. In a synovial joint, as I have already mentioned, you have a cavity. That is called the synovial cavity. Synovial cavity. So there is a space in between the bones, and that cavity contains a fluid that is called synovial fluid. Synovial fluid. And the end of the bones are covered by hyaline cartilage. So this is the hyaline cartilage that covers the end of the bones, and that hyaline cartilage covering is called articular cartilage. Articular means joint, articulation. So cartilage in the joint, articular cartilage. What kind of cartilage is that? Hyaline type cartilage. Okay. So articular cartilage is a hyaline cartilage. And around the joint you have the capsule, articular capsule or joint capsule, that wraps the joint around. Okay, so this is the articular or joint capsule. Okay, it's like a double layer membranous structure. So it has two layers, remember, the outer and inner. So this is joint capsule that covers the joint around, and it has two layers. The outer layer is called the fibers, outer fibers layer, and inner one is the synovial membrane. Synovial membrane. Okay, so outer fibers layer or fibers capsule and inner synovial membrane. Those are two layers of the joint capsule or articular capsule. Now from the inner synovial membrane, synovial fluid is secreted. So from this inner layer, the synovial fluid is secreted into the cavity. Okay, so that's how you get the fluid, synovial fluid. So here you see the structure of a synovial joint. Okay. Articular capsule has outer fibrous capsule and inner synovial membrane. And you see the ends of the bones are covered by articular hyaline type cartilage, and you have a gap, that is the cavity, and it contains the synovial fluid. Okay. So if in the test I ask you to draw, in your lab you also have to draw this picture. Okay. It's important. In large synovial joints, not in all, in large synovial joints, we see Barsa. Barsa are flattened membranous sacs. Flattened membranous sacs filled with synovial fluid. So, in many synovial joints, we see flattened membranous sacs filled with synovial fluid. That is the Barsa. And Barsa act as ball bearings where the ligaments, muscles, skin, tendons or bones rub together. Barsa reduces the friction. How the Barsa works? You see, if this is a bone and this is a ligament or a tendon, this one is a Barsa here. So this is the Barsa sitting in between the bone and the ligament or tendon. So what happens when you move the bone? The Barsa rolls like this in between those two structures, and that reduces the friction and also increases the movement. Make sense? It's like, if you put wheel under your shoe, you can easily, go like fast. So Barsa act as ball bearings in your joints. But not all synovial joints have Barsa. That's why we did not include this as a part of synovial joint. When I showed you the parts of a synovial joint, I did not include Barsa because it is not a part of all synovial joints. This is an important Barsa that is called subacromial Barsa. You already know that this part of the scapula is called the acromion. So sub means under, subacromion Barsa is here under the acromion. And when you move your humerus, head of the humerus, this Barsa rolls like this, and that reduces the friction, prevents the friction between this bone and this bone, as well as there is a ligament here that is called coracoacromial ligament. This is the coracoid process. So this is the ligament here. So your subacromial Barsa is under the acromion as well as under the coracoacromial ligament. So that also reduces the possibility of friction between the ligament and the bone. Sometimes if something hits from outside, like road accident or something hits you in sports, that can cause the rupture of the Barsa, and in that case the movement will be restricted and will be very painful. Another condition that happens, inflammation of the Barsa. If you use the joint too much, or any infection occurs in that area, in that joint area, that can cause the inflammation of the Barsa. That is called bursitis. You will hear this term of okay. Bursitis is the inflammation of the Barsa. It can happen due to excessive use of the joint, okay, or infection. Microbial infection. Movement occurs at the joint, and we know that bones cannot move without the muscles, right? So we move the bones at the joints by the muscles or with the help of the muscles. Without the muscles, you cannot move the bones at the joints. So we move the bones at the joints with the help of the skeletal muscles. So the skeletal muscles are attached to the bones. Now, you see, the skeletal muscle has two ends. For example, this is a skeletal muscle like this. One end is here, another end is here. Makes sense? Two ends. Now, when this muscle contracts, what happens? It pulls the forearm towards the arm like this. Makes sense? So you see here, this bone is not moving. This bone is moving towards this. Right? So now, the end of the muscle which is attached to the fixed bone, that is the origin, and the one that is moving towards the origin, that is the insertion. So this end is called the insertion, and this fixed end is called the origin. So when movement occurs, insertion moves towards the origin. Make sense? Insertion moves towards the origin. Now, movement occurs in three planes. You already know those planes. This is the transverse plane, right? In your first lab, you have learned that. Transverse plane, right? And this is the sagittal plane. You know sagittal suture, right? Sagittal plane. And this is the frontal or coronal plane. You have already learned that. Now, if I move my head this way, which plane is this? Sagittal, right? Sagittal plane. So this is sagittal plane movement. Make sense? This way. You know, sagittal plane is this way. Now, this way is what? Frontal. So if I move my head like this, that is the frontal plane movement. Clear? Okay. Now, tell me, I am moving the upper part of my body. Okay. So watch my upper part of my body. So which plane is this? Sagittal. Very good. Now I am moving my body this way. That is what? Frontal. Make sense? We are moving this way. So frontal. You know, this way is frontal. This way is what? Sagittal. Okay. Now this way is transverse, right? So what is transverse plane movement? I am moving my head in transverse plane. This is transverse plane. Make sense? Going this way. So if I want to move my upper part, rotation, that's the transverse, right? Like this. So those are three planes of movement. Now we also use two or more combining together and make the movement of different body parts. In synovial joint, many different types of movements can occur. Many different types of movement can occur in a synovial joint. So we'll see what are different types of movement. The three, those are the planes: frontal plane, sagittal plane, transverse plane, and these are the name of the movements. Okay, gliding. If the bones have flat surfaces, like this is one bone, this is flat surface of the bone, this is another bone, this is the flat surface. Make sense? So two flat surfaces get attached to each other, then what kind of movement possible? Only like this, right? Flat surfaces. So that is called gliding type movement. Two flat surfaces like this type of movement. And where you see the gliding movement? We see the gliding movement in between the short bones. For example, the carpal bones. These are short bones. So what happens? This is one carpal. This is another carpal. This kind of movement occurs. Makes sense? To flat surfaces. Angular movements, where the size of the angle changes. Example, you see here, this is my forearm, this is my arm, right? And watch this angle, what happens, okay? You'll tell me this angle. Now it's like 180 degree, right? Straight. So now it's getting what? Bigger or smaller? Smaller, okay? So this is the flexion, okay? When one bone moves towards the other. Make sense? That's and angle gets smaller. This is flexion. Opposite of flexion is extension, where the angle gets bigger, and it is opposite of the flexion. Opposite direction of flexion. So this is the flexion of the forearm. This is the extension of the forearm. Make sense? Now see this angle here. I'm moving my head. So this angle is getting smaller, right? Here. So this is the flexion of the head. Make sense? This is the what? Extension of the head, right? Opposite. Now, in some joints, we can do hyperextension. So again, say this is what? Flexion, right? This is extension. Now, if I ask you to do more, you can do that, right? That is hyperextension, going beyond the normal anatomical position. This is my anatomical position, right? So this is flexion, this is extension. Now if I want to move more, I can do in this joint, that is hyperextension. Now see here, forearm, again going back, this is flexion, right? This is extension. Can I do hyperextension in this joint? No, I cannot go beyond that, right? So in some joints we can do hyperextension. Again, see my upper part of the body. This is the flexion of the upper part. This is the extension, and this is hyperextension, going beyond that. Make sense? Okay. Abduction, adduction. If you take your body part away from the midline, you know this is my midline of my body. If I take my arm away, that is abduction. Okay, and bring towards the body a midline, that is adduction. Abduction, adduction. Makes sense? This is what? Abduction, right? Taking away. Sideway, right? Abduction, adduction. Makes sense? Circumduction. If you draw a circle, the movement occurs here in the shoulder, that is a circumduction. The circle could be very small. This is circumduction, as well as very big. This is also circumduction. Okay. So if you draw a circle, the movement occurs. That is the circumduction. Clear? So if I ask you to draw a circle with your foot on the ground, that is also circumduction, right? Circumduction of the hip joint. Is it clear? Okay. You know, in some sports like cricket, we don't watch much cricket here, right? We see baseball a lot, but cricket is popular in Europe, Australia. How they throw the ball, you have to make a circle. You must make a circle to throw the ball. You cannot, flex your shoulder or elbow. So that is the circumduction. Okay? Circle. Rotation. In rotation, the movement occurs around the axis. So this is the axis. Now if I move my hand, this is rotation. The axis is not changing, right? You see here, this is the axis. Around the axis, you are moving like this. So it is not moving. So this is rotation. Now you tell me, if I move like this is what? I'm drawing a circle, right? So this is circumduction. All of you should. This is what? Circumduction. And this is rotation. That's the difference. In circumflexion, the axis is changing, right? But in rotation, the axis is not changing, staying same. So now you tell me, if I move my head like this is what? Rotation, because the axis is not changing, right? See, the axis is staying same. Around the axis, my head is moving. So rotation. This is called lateral rotation. This is medial rotation. Make sense? Bringing medially, laterally. So this is what? Lateral. This is, how about this? How about this? This. Make sense? Lateral, medial, rotation. Special movements in particular joints. Supination pronation. If you move your palm upwards, that movement is supination. If you turn your palm downwards, that is pronation. So this is what? Supination. This is pronation. If I put like this is supination, this is pronation. Make sense? So in supination, your radius and ulna, these two bones stay side by side. This is supine position. Now when you do pronation, what happens? This end of radius goes to the other side. That means what happens? Crossover occurs. That means this end of radius goes over the ulna. Okay? And that happens. Dorsiflexion and plantar flexion. This surface, the upper surface of the foot, is called the dorsal surface, and the sole of the foot is called the plantar surface. So this is the dorsal surface, this is the plantar surface, if this is your foot. Make sense? So now, if you move your foot upwards, that is called dorsiflexion, because this is dorsal surface towards dorsal surface. So see here, this is dorsiflexion of the foot. Okay? Now this is the plantar surface. So if you move downwards, that is plantar flexion. Dorsiflexion, plantar flexion. Inversion, eversion. If you move the plantar surface or sole towards you, inwards, that is inversion. Outwards, eversion. So this is inversion. Another way you can remember, the big toe moves up in inversion. Big toe moves what? Up in inversion, and down in eversion. Protraction, retraction. You have seen protruded mandible. We sometimes see someone mandible is pushed outwards. So we say protruded mandible. Protraction means pushed outside, outwards. So if I move my mandible forward, that is protraction. Makes sense? And pull back. Pulling back is retraction. We also use the word retraction, right? Have you heard this word before? We have retracted our soldiers from somewhere, right? That means we have pulled them back. That is retraction. Right? So protraction, retraction. Elevation, depression. Moving down is depression, we all know. Moving up is elevation. So when you open your mouth, what happens? Mandible. What is this? Depression, right? When you close your mouth, elevation, right? Elevation, depression. So those are different types of movement occur in the synovial joint. So now you will understand gliding in between the carpal bones, two flat surfaces. flexion of the head, extension of the head, hyperextension of the head, flexion of the upper part of the body, extension, hyperextension, flexion of the leg. This is the leg. So you see here this angle gets smaller. So this is flexion, this is extension. Okay. Abduction, taking away, sideway, away from the midline. Adduction towards the midline. Circumduction is circle. Rotation is around the axis. Okay. Lateral medial rotation. This is pronation and supination. Dorsiflexion, plantar flexion. Okay. Inversion, eversion. Protraction, retraction. Elevation, depression. Okay. So those are different types of movement. Now we'll see the structure of couple of large synovial joints. Most of the joints of our body belong to synovial joints, but largest synovial joints is the knee joint, and other large synovial joints are elbow joint, shoulder joint, hip joint. But knee joint is the largest one, and the most complex joint of your body is the knee joint. Why it is the most complex and the largest? Because knee joint is actually a joint of three joints together. Three joints inside the knee joint. You have three joints. What are those three joints? You see here in the lower end of your femur, you have condyles, lateral and medial condyles. These two condyles articulate with the condyles of the tibia and form lateral and medial tibiofemoral joints. So those are two joints separate, and patella or kneecap forms another joint, femoropatellar joint, right? So those are three joints together form the knee joint. That's why this is a large and complex synovial joint. If you see inside of the knee joint, you will find some Barsa, flattened sacs filled with fluid, synovial fluid. So the blue structures here are the Barsa. We'll see the main Barsa in this joint. Above the patella, you have suprapatellar Barsa. Very easy. Supra means above the patella. And if you see carefully, you see this Barsa is important because it is separating the tendon of quadriceps femoris. It's a strong tendon here and the bone. So the friction won't occur when you will move the bones because of this suprapatellar Barsa. Another Barsa is under the skin before the patella. So this is the skin, and under the skin this is subcutaneous. Cutaneous means skin, sub means under. So subcutaneous pre-patellar Barsa. Before you reach the patella, you will get this Barsa, pre-patellar Barsa. Infrapatellar Barsa, under the patella. Infra means below, supra means above. So this one is infrapatellar Barsa. It is called deep infrapatellar Barsa. It lies under the patellar ligament. Another very important ligament. You know that knee jerk testing or knee reflex is done by hitting on this patellar ligament, right? So under this ligament you have the deep infrapatellar Barsa that reduces the friction. So here you see that Barsa separates the skin and the bone tendon and the bone, ligament and the bone. Right? Now, if you see the ends of those two bones, femur and tibia, femur is above, tibia is below, both ends are covered by articular cartilage. This is an important property of synovial joint you already know, and that is a hyaline cartilage, articular cartilage. You have a cavity, right? Because it is a large synovial joint, it must have a cavity. That's the synovial cavity in between the bones, and that cavity contains the fluid called the synovial fluid. You have articular capsule. So those are the properties of synovial joint. Now inside the joint you have cruciate ligament. There are two cruciate ligaments, anterior and posterior. Okay. Sometimes we see turning of the ligaments, cruciate ligaments. Around the joint you have some ligaments or tendons. So these are the ligaments and tendons around the knee joint. So first you see above the patella you have tendon of quadriceps femoris. Quadriceps femoris are four muscles together. That's why called quadri. They together form a tendon that gets attached to the upper part of the patella, and that is the tendon of quadriceps femoris muscle. And below the patella you have the patellar ligament that goes from the patella to the tibial tuberosity. You know, tibial tuberosity is here. So patella to tibial tuberosity. Now above the patella, same structure you see, above the patella it is called a tendon, quadriceps tendon. Below the patella its name is ligament. Why? Tendon connects muscle to bone. So if the structure connects the muscle to the bone, that is a tendon. If the same structure connects one bone to another bone, that is a ligament. Okay. So here patellar ligament connects the patella and tibia. That's why it is a ligament. Okay. Then in both sides of the patella you have retinaculum. Medial patellar retinaculum, lateral patellar retinaculum. Retinaculum is a ligament, but it is flat. If you see a flat tendon or ligament like a sheet, flat thin sheet of ligament or tendon, that is called a retinaculum. Structure is same as ligament or tendon, but it is flat and thin. Then beside the retinaculum you have collateral ligaments. In tibial side you have tibial collateral ligament, in fibular side you have fibular collateral ligament. Okay, so those are the structures around the knee joints, and those ligaments, tendons or retinaculum, they support the joint. Now we know that the end of the tibia and femur are covered by hyaline cartilage, articular cartilage. Also in the upper end of tibia, around the hyaline cartilage you have fibrocartilaginous structure. only in the knee joint here. Around the hyaline cartilage, you have fibrocartilaginous structures. Those are called meniscuses. So meniscus, probably you have heard, right? Meniscus in the knee joint. Meniscus is a fibrocartilage around the hyaline cartilage. And turning of meniscus is commonly heard. We hear turning of cruciate ligament, turning of meniscus, and that occurs in the knee joint. Here you see the turning of the cruciate ligament as well as the meniscus. Also you see turning of the tibial collateral ligament. Usually what we see, if something hits, like this is a joint, see here, this is a joint. If something hits from this side, then what happens? The bones go like this, right? And pressure is created in the opposite side. So turning of ligament or meniscus occurs in the opposite side. So here you see the same thing has happened. Okay, now we'll see the shoulder joint. Shoulder joint is a ball and socket type synovial joint. Why we say ball and socket type synovial joint? Because the head of the humerus has a ball. Head of the humerus is like a ball, round, and socket is the glenoid cavity. Right? So those two structures form the joint. Head of the humerus, which is like a ball, and the glenoid cavity of the scapula, which is a shallow socket, shallow cavity. And this joint has three types of ligaments: coracohumeral ligament, coracoacromial ligament. Those are 1 in number, and 3 glenohumeral ligament. Okay, so those are the ligaments around the shoulder joint. Now very easy, these names. Coracohumeral. You know, this is the coracoid process of the scapula, and this is the humerus, upper end of the humerus. So coracohumeral, from the coracoid process of the scapula to the humerus. Coracohumeral. Make sense? Coracoacromial. You know, this is coracoid, this is acromial. So coracoacromial ligament. Make sense? Glenohumeral. You know, this is the glenoid cavity. So from around the glenoid cavity to the upper end of the humerus, glenohumeral. There are 3 glenohumeral. Okay. So those are the ligaments. And names are very easy. Just if you know the name of the parts: coracoid, acromion, humerus. Okay. Also, you already know that there is an important Barsa here that I have mentioned, that is the subacromial Barsa that rolls, right, when you move the humerus, and that separates the bone, 2 bones, acromion and the head of the humerus, as well as the coracoacromial ligament and the head of the humerus. So that's the subacromial Barsa. Here you see those ligaments: coracohumeral, coracoacromial, and glenohumeral. Okay, so that's the structure of the shoulder joint. Okay. Do you have any question? No question? Okay.